So alright, what we have in our differential today is, this is the menu. Okay, preeclampsia, the first thing that we have to see is the blood pressure. Okay, if the blood pressure increased, then we have to see for the seizure activity or maybe like the protein your hand went to deliver the baby, not sort of thing. But the first thing we need to rule out is either it's like the normotensive or the hypertensive. First thing. Second is intrahepatic cholestasis of the pregnancy. Okay, in pregnancy, we have the increase in the estrogen, we have the increase in the progesterone. So you have the biliary stasis, you have the ponic stasis, you have the constipation, and biliary stasis. Whenever there is a stasis, look, you have the increase in a bilirubin, so you have the in a bile salt, you have the increase in a transaminase. The bile salt should be like less than 10. If it gets increased, it starts spilling out in your body. So you have the pruritus, number one thing, the pruritus of the hands and feet, and then it crosses the amniotic fluid. So that if you have the meconium amniotic fluid as well, you can have the lung problem of the test, you can have the intrauterine growth retardation, as well as you can have the fetal demise. So you have to deliver the baby at the 37th week. You have to give the antihistamine for the pruritus, and you have to give the ursodeoxycholic acid for the bile salts. And for the HELLP syndrome, we have the LU hemolysis. So you have the increased bilirubin, you have the decrease in RBC, you have the LU wicked liver enzyme, you have the platelet. Low platelets, like it's less than going to be 1000 K. Acute hepatitis is going to give you all IgM, and chronic is going to give the IgG. Okay, and acute fatty liver of the Bensi means you can have GAF, you can have the leukocytosis, you can have the pain over here, you can have the preeminent liver, so it can lead to a lot of complications. So what is the question? The ultrasound the 38th week develops no fetal IVD. So this little fetal is like dead. So we have to know the cause rate from these. Okay, let's start looking at it. This is positive, this is positive, but this is like chronic because it's not acute. So we are going to chop this out because it's chronic, it's not acute. For it to be acute, we need to have IgM. All right, next thing that we have is, okay, these all are increased. So the first is increase in the LFTs. And then we have the bile salts. It should be less than 10, but it is like very much increased. So the second symptom is bile salts. So as of now, with these two labs, we'll find out that it's this, because bile salts are increased and have given like the antihistamines for that. Okay, let's just confirm it. Come to 37th week and no fetal activity, the decreased moment. We know that the cause of it, right? And there's like no contraction, okay? And she developed, here is our catch, generalized, and you don't need to read anything else. Itching and the decrease in fetal activity, two things. The fetal activity is decreased and we have the itching. That means it is a bile salt related thing. Bile salt is spilling out, and which is going to give you the itis. So for the bile salt, we had given the antihistamine, we had given the ursodeoxycholic acid, and the delivery by the 37th week. We know that. And yeah, but let's just read it. It is just on the hands and it is on the feet. To the nausea. And what else we have? Immigration status, nothing. Okay, so the pain is at this part. And yeah, so it's like pretty much obvious to some probably then things better.